it will probably be a difficult journey, that there will be some days that they will be scared or that they will be angry. Every voice matters, every story resonates.
Rebecca, I'm very happy to be here with you today in the beautiful city of Lisbon. So we are here together to advance the understanding of a disease called myositis. You are a pediatric rheumatologist, and today I would like to focus on your journey, your perspective, and to really understand what it means to work with children living with a rare disease. Could you tell me a little bit about yourself and what first inspired you to work with children?
Well, I started my medicine training already knowing that I wanted to become a pediatrician. So I always wanted to work with children. This is because I really love to interact with them, and also I find it astonishing the way they react to difficulties and also to the disease. So this is something I had experienced already during the medicine training. And so I really early in the beginning of my medicine training, I decided that I wanted this to be my specialty.
Okay, so your path was really clear almost from the beginning,
yeah.
I may say. You care for children living with a rare disease. How do young patients experience such serious condition compared to adults? Is there a difference?
So what I see is that, but this is something that I in general see in children reacting to diseases, that they are very much more resilient. So they get to the really difficult periods of their life and to treatments and hospital stays and appointments, and still have their life as children. But also, during my journey in the myositis clinic, I had the chance also to get in contact with patient organizations, parent organizations, and so I became aware of the fact that not everything is addressed with the physician during the visit. So there is a lot ongoing that maybe doesn't come up during the visits, and a lot of things that matter to the patients and to the children and also to their parents, that maybe they are afraid to speak with the physician. And so also aspects that maybe I wasn't aware of that really matter to them.
You talked about visits with children and their parents. I would like to talk specifically about the first meeting that you can have with the children and the parents that I guess occurs often after a long diagnosis journey. What is for you the most important thing during this first visit?
During the first visit or the first meeting with the children and the parents, I think the most important thing to make clear is that this is a complex disease, but that we have means to try to cure it. So it can be a chronic disease, but it can also be a disease which requires treatment for some time, but then goes into remission and never comes back. And that even if there is a relapse or there is a chronic disease course, that we have means and therapeutic approaches to try to get them a normal life and to try to control the disease.
Okay. Many of your patients obviously have juvenile myositis. For people that are not familiar with this kind of disease, could you describe what it means, or how is the daily life of a kid living with such condition?
Well, myositis means inflammation of the muscles. And the most common type in children is juvenile dermatomyositis. So this is a disease affecting both the skin with several different skin rashes, which can be different over time, and muscle inflammation, which leads to muscle weakness. So the impact for the children with myositis is mostly on the functional and aspect. So because the muscle weakness interferes with daily function, with playing, with sport activities. But also the skin rashes can be very debilitating. When you think of an adolescent with evident skin rashes, this is really something that impacts on how they see themselves, how other people see them. So both aspects are really relevant to the children and adolescents with this disease.
How do you explain such a complex and serious condition to a child, in a way he or she can understand it?
Well, the way I usually explain it is that in our body we have some cells which are sort of soldiers, which usually are there to defend us from outside aggressors such as bacteria or viruses or parasites. But in some cases, in some conditions, these warriors go crazy and attack parts of the body they shouldn't attack. And with the treatments we give them, we try to report them to their normal condition and to be able to not target anymore the tissues of the body, but only the outside aggressor. So
I'm sure some of the kids do enjoy the comparison with warriors or soldiers. You are a mother yourself. Does this change the way you see the children or the parents?
I think, I guess I'm a bit more empathic. So sometimes when I speak with the parents or with the children, I really I get a bit emotional, and it's sometimes difficult to be also professional when you. But I mean, you have to find the correct balance. Mm-hmm. I think it's important that you remain empathic, but on the other hand, you must tell the family and the children how the situation is and what you suggest to do to best address the clinical picture of their child, and to which is hopefully the way to treat the disease best. But sometimes it's difficult.
Speaking about emotions, you're also very active in research and involved in the development of innovative therapies. And you and your team were recently observing very nice results in some patients that had exhausted all therapeutic options. How did you feel when you noticed the first improvements in those patients that received these innovative therapies you are working on?
Yeah, this is really, I mean, when I first started the myositis clinic, the thing that really impressed me is how poor the therapeutic choices were for these patient population compared to other diseases such as juvenile idiopathic arthritis. The treatment options are really limited, and when we started to use this innovative cellular treatment, I must say that the results exceeded our expectations and our hopes, because really in patients which had active disease for years without really getting a complete response to any of the previous treatments, we were able to see a remission without the need of ongoing immunosuppression and ongoing steroids. So this needs to be confirmed, but really we are hopeful that this is at least an option which can provide for patients which are very refractory an option that can give us prolonged periods or maybe sustained periods of remission.
Yeah, even as you said it has to be confirmed. I think you can really enjoy the achievement because it's huge for these patients. Are there any moments that you spent with young patient that will stay with you forever, or perhaps that changed the way you see your profession?
Well, really, one patient where I really have remembered the first time I spoke with him was the first patient we treated with this innovative cellular treatment, because he had a really a sad story. He came from Ukraine. They had to leave their country because of the war. They came to Italy with a really uncontrolled disease. And I mean, he just asked me, I want my face to become white again, because he had so bad rashes, and I want to have my skin back again. And I had to shortly get out of the room because I was, I told them, we will do our best to get you there, and there are treatments that you haven't done that maybe we can try. And at the end, nothing worked, so we treated him with CAR T cells, and he responded so well that when a few months after the treatment, I was not able to see him at his follow-up visit. He sent my colleague who saw him in the follow-up, sent me a short video where he told me, "Hi, Rebecca, Nicolai. Hi, Dr. Nicolai. I just wanted to let you know that I'm playing soccer on the beach, and I'm so happy that I have no central line anymore." And really, I started crying because this is, and these are moments that stay with you forever.
I can imagine. And this leads me perfectly, I think, to my last question. If one of your young patients, for example this one, were to watch this conversation years from now, what message would you like him or her to hear from you?
That it will probably be a difficult journey, that there will be some days that they will be scared or that they will be angry, but that at the end, most probably they will be able to get to their normal life and do what their friends and their classmates do. And that is very important, that they always keep speaking with their physicians, and that they give us feedback on what they need.
Okay. Thank you so much, Rebecca, for this conversation. I think that behind every diagnosis, there is a human story, a kid, a family, and a person like you working every day to do what it's possible to improve his or her condition. So thank you very much for your hard work and for this conversation.
Thank you for what you're doing.